continuing our conversation surrounding women's health and wellness, and more specifically, cervical cancer. Now, when it comes to cervical cancer, early detection can make a world of a difference. And here to help us learn what symptoms to look out for is Phoebe primary care obstetrician, Dr. Kayla Suma. Welcome to the show.
Thank you so much for having me.
Yes, 100%. Love to have you. Now, from an obstetrician's point of view, how important are early detection and preventive measures when it comes to cervical cancer?
Certainly. I don't think it would be at all hyperbolic to say that it is life or death for many patients, especially in rural communities who may not have access to treatments or preventative health measures. It can be the difference between life and death.
Yes, wow, that's very important to understand. Now, does family history play an important role in cervical cancer risk?
You know, traditionally we had thought about cervical cancer as being completely mediated by the human papilloma virus, or HPV. And oftentimes we kind of wrote off genetics or family history, but we have discovered that certain communities, especially different minorities, tend to be disproportionately affected by this cancer. And additional research studies have shown that there are some genes that make HPV more likely to cause dysplasia, metaplasia than others. But I would still say the biggest component is probably access to things like early immunization and preventative health screenings, but certainly race can play a big role as well.
Absolutely, and I want to take a second with that because, again, like we mentioned in our previous interview, that we know certain populations are at more risk. Do we fully understand why that is? I know we talked about population, but do we fully understand why that is?
Yeah, we're doing a lot of research on that now, but there has been data that shows there are so many HPV subtypes, and different subtypes tend to be more predominant in some populations than others. And so early research kind of dictated which of the subtypes of the HPV virus were going to be included in the immunization and also in the screening tools that we use. But over time we have realized that there are other high-risk HPV subtypes, and we have been able to kind of expand the panel in the immunization as well as in our screening, but we still have room to improve.
Got you. Absolutely, absolutely. Now, what are some symptoms that people should be aware of and be on the lookout for?
Yeah, that is a great question. Unfortunately, cervical cancer can be largely silent. People are completely unaware that it's processing in their body. Of course, you should be worried if you have abnormal uterine bleeding, which is to say bleeding that is not occurring during your normal menses, either between cycles or particularly heavy, or happening after intercourse. If you're having pain with intercourse, or if you notice any kind of abnormal odors, things like that. And in advanced cervical cancer, you can have a lot of urinary symptoms like blood in your urine, or even obstructive processes like recurring urinary tract infections.
Okay, so is it fair to say that the best way to really go about this is to get screened?
Absolutely. Well, I can't emphasize enough that the first most important thing is immunization, and that's for both boys and girls because they can share it with one another as they, come of age and fall in love and enter platonic, happy, healthy relationships. But you can get immunized as early as 9, and you only have to get 2 vaccinations if you're less than 14 when you complete the series. If you're over 14, you have to get 3, and they just increased the age that you can get this series up to 45 years old. So it used to cut off at 29. They felt there was no additional benefit, but now we're vaccinating men and women up to age 45.
Got you. Okay, now there is another key point that I really want to make sure we drive home. How important is it for people to be honest and open with their physicians?
Absolutely critical. And even just seeing a physician is super important. So we recommend this routine screening, depending on your age, every 3 to 5 years, assuming your results are normal. But oftentimes people fall off and don't get their routine pap testing. And so it's important to communicate with your doctor whether or not you've had your pap, what those results were, if they were with another provider, and if you had an abnormal pap, to go back and follow up on those abnormal results and make sure you get the subsequent care that you need.
Got you. Absolutely. Well, thank you for making time for us today. This is such an important conversation, so
Absolutely.
I'm really glad that we're having it. So thank you.
Thank you so much for having me.
Yes, absolutely.